Life is full of uncertainties, and one such uncertainty is illness. We can never be sure when someone close to us, or maybe even we ourselves, might fall ill. And when we do need to seek medical care, we would like it to be the right care. But if we want the right care, we may need rights. Now, let me explain to you why that is so with an example. Sumanta Mukherjee was a young engineering student in Kolkata. He was riding his motorcycle and he had an accident. He was taken to a private hospital, and in the private hospital, the hospital demanded rupees 15,000 to start the emergency treatment. Now, Sumanta had medical insurance, but he didn't have the cash on him at that point of time. So he requested the hospital to start the treatment, but they refused to do so until the full amount was given in cash. And because of this, there was a delay, and unfortunately, Sumanta died. I think you'll agree that what happened to Sumanta should never happen to anyone. And to prevent such situations, over a period of time, we have evolved a system of patients' rights. Now, what happened to Sumanta is something not very rare or uncommon in our country when it comes to commercial private hospitals. As a medical doctor and as part of our team at Sathi, we have come across dozens and dozens of stories of people who had to suffer from medical negligence, from gross overcharging, and sometimes unnecessary procedures or unnecessary operations in private hospitals, leading to massive loss of finances, of health, and sometimes even of lives. Now, I don't want to depress you with these stories. Instead of that, I will introduce you to a friend who can help you to avoid such situations, who will protect you in all situations when you're in a hospital. And this friend is the Charter of Patients' Rights. The Charter of Patients' Rights, which I'm talking about, has been adopted by the National Human Rights Commission recently. And this applies to both public and private hospitals. And similar charters of patients' rights are there in most other countries of the world. So now let us see what are these rights and how they can protect us. The first set of rights are our rights as consumers. Now it is said that the consumer is king. But in a hospital setting, actually the consumer may be at a significant disadvantage. Now how is this so? When you go to a restaurant, what is the first thing that you ask for? You ask for the menu. Now, you look at the menu, you look at the rates, and then you decide what you want to order. Now, imagine going to a restaurant which gives you a menu without any rates in it. Would that be useful? Not particularly. Unfortunately, many private hospitals are like that. You go to the hospital, and to begin with, there is very little transparency about the rates. And this leads to certain very, very uncomfortable situations. For example, you might have heard the story, which took place in 2017, of a young girl who was taken to a big corporate hospital near Delhi. She had dengue. She was treated there for a fortnight. Unfortunately, the child died, and the family was given a whopping bill of rupees 16 lakhs without any explanation. Now, these are the kind of situations that we need to avoid, and that is why we have a right to transparency in rates in private hospitals. And linked to that is the right to information. Every patient has a right to know what is their illness, what is the diagnosis, what is the line of treatment, are there any risks which are involved, what are the expected costs, and finally, at the time of discharge in a hospital, a detailed itemized bill of the treatment. And this right to information is linked to the right to all records and reports. Because if your patient is admitted in a hospital, you have the right to not only receive all the laboratory test investigations, and also the imaging reports like, say, an X-ray or an ultrasound, but also you can access the indoor case papers and get a photocopy of these if it is required. And these are required because you may want to take a second opinion. You may want to consult another doctor, and for that, you may need these reports. Now, another situation which we encounter in certain private hospitals is that they insist that the patient must buy all the medicines from the hospital's own pharmacy. And this is not accidental, because actually the rates may be inflated in the hospital pharmacy, and the same medicines can be available outside at much lower rates. And to prevent this kind of exploitation of patients, we have a right to choose the source from where we would like to buy our medicines or get our tests done. Now, moving forward from this set of rights, we have another set of rights which are linked with medical ethics. And coming back to our restaurant analogy, when we go to a restaurant, we pay the bill and we decide what we want to order. But when you go to a hospital, you pay the bill, but you don't decide which medicine you're going to consume or which test you're going to undergo. It's somebody else who decides. It's the doctor. Now, because we hand over to the doctor this power of decision making, that is why we also need to have certain rights to protect the patient. And one very important right is the right to informed consent. Now, healthcare is like a double-edged sword. It's usually beneficial, but sometimes it can be hazardous. And therefore, before any potentially hazardous procedure, whether it's an operation or an investigation, a full information about the risks must be given to the patient and the family, and adequate time should be given. Any options which are available should be suggested, and only after that, taking written consent, then only the procedure should be conducted. And this should be done with adequate time, not in a cursory way just before the patient is being rolled into the operation theater. So these are certain important rights. And then we have, of course, have certain rights which are linked to legal provisions. And I've already talked about the right to emergency medical care. Now, there's another right which is violated not only for live patients, but even for the dead bodies of patients who die in a hospital. And you might be aware that certain hospitals, private hospitals, have this practice that if a patient dies, they demand the bill, and if the full bill, according to their calculation, is not paid, they refuse to release the dead body of the patient. This is completely illegal. This amounts to illegal detention. And we have a right to take the discharge of our patient or the dead body of a deceased patient from the hospital without any such preconditions. Now, having said this, all these rights are very important, but at the same time, as patients, we do have certain responsibilities also. And a patient has a responsibility to give the required information to the doctor at the time of treatment, to cooperate with the hospital staff during the course of the treatment, to respect the human dignity of the hospital and healthcare providers, and also to not indulge in any kind of violence in a hospital setting, whatever the grievances may be. And I'd like to add that wherever possible, we should try to seek out an ethical doctor who will give us appropriate care, and my colleague, Dr. Arun Gadre, will be talking about how to do that. Now, I have very briefly highlighted just a few of these patients' rights. If you want to access the entire Patients' Rights Charter, you can visit the NHRC website. And also, now we have a national campaign on patients' rights, which has been developed across the country. If you want to support this campaign, if you want to know more information, and if you have any specific queries, you are most welcome to visit our website and get in touch with us. So in the end, I'd like to say that I wish all of you a very healthy life, and I hope that none of you need to access healthcare, at least in the near future. But if you do land up in a challenging healthcare situation, don't be patient with malpractices. As a patient, demand your patient's rights. Thank you.
Thank you, Abhay. What makes a good doctor? I remember a Sanskrit sloka. Vaidyaraja namostubhyam yamaraja sahodara yamastu harati pranan vaidyo pranan dhananita. Meaning, hey doctor, we bow before you because you are brother of Yama. Yama takes life away from us, and you take life as well as money. Well, that was 1,000 years back. Now we have evolved into modern age where health and health care are supposed to be social good. And we are inching towards that. Abhay has told you about the patient's right. So a good doctor respects the right of the patient to get information about illness, investigations, procedure, surgery. Honors the patient's right to give informed consent after having understood the pros and cons of the options available and does not get irritated or angry if the patient goes for second opinion. It is a right. But the question remains, how to recognize a good doctor? Well, I think I am well placed to ponder on this question. I am a gynecologist. I ran my own hospital in a small rural town of Maharashtra for more than 20 years. I tried to be that good doctor with all my sincerity. And I'm a patient as well. I'm a patient of angioplasty. When I had chest pain, I needed to find a good doctor. When we approach as a patient to the doctor, we face nearly unsurmountable information asymmetry and power asymmetry. We know very little and we are helpless. We may be fighting life and death battle. We may be suffering. We may be fearful. We may not be in the right condition to understand rationally. Here comes the first foundational characteristic of a good doctor. Good doctor allows patient to ask questions, tries to understand the fear and helps the patient to cross the bridge as far as possible. Personally, I would not go to the doctor who treats my question like some irritant. Good doctor puts all the options before the patient. She does not force her option. On the contrary, whenever possible, she takes into consideration patient's individual, socio-economical, psychological, and spiritual viewpoints. I remember a touching story. A 70-year-old woman was brought to me with cancer cervix spread across her body. Another doctor had tried to force chemotherapy and radiotherapy. And he has frightened her with all the consequences if she does not opt for that, like pain, stench. No wonder the poor family was bent on selling their only land. I told him, look, as per evidence, in your case, chemo and radiotherapy will not do better than palliative care. If you go for palliative care, the old woman will die at home among the near and dear ones. The moment I spoke, the old woman cried and cried and cried. She was begging for that option for the last 1 month. And when I, as a doctor, also gave that option, a heavy burden was lifted from the family. The son came with inevitable news, but he was very happy. He could satisfy the last wishes of his mother. Medicine is very uncertain and cruel terrain. We doctors, as we grow in experience, become humbler. Unexpected complications are not uncommon. So a good doctor is humble one. She does not shy away from asking for help when there is a need. A pediatrician has told this story to me. A 15-day child was admitted with fever in a hospital. When it was not getting cured, the family suggested getting help of a pediatrician. The doctor was so furious that it became a task for the family to shift the patient. The diagnosis was meningitis, brain infection. And because the child was timely shifted, it could be saved. Glitter of technology and cushion of affordability has now distorted a behavior of a section of the patient. They think more money we spend, more advanced technology we use, better. They come with some preconceived notion and insist. And mind you, self-diagnosis has increased exponentially after the advent of who else? Dr. Google. It's an interesting case now. One orthopedic was treating a mild or moderate knee joint arthritis of an old man. His daughter, engineer daughter, called from US and suggested that orthopedics should go for total knee replacement surgery. She assured him she had done enough research and money is not the issue. The orthopedic told her very firmly that as per medical principles, he would not go for any surgery unless conservative treatment fails. The old man got cured within few months. Remember, we talked about power asymmetry. This term has become derogatory nowadays because few doctors, some doctors and some hospitals use their power asymmetry to exploit patients. But I would now take a politically incorrect position and would advise you that look, you have got a good doctor, you have found one. Now accept power asymmetry as an inevitable part of your relationship with your doctor. In simple words, have faith in your doctors. We doctors require your faith. We are not gods. Remember, the key to find a good doctor is to start with realistic and mature expectations. If you begin right, you will get a good doctor because there are many around. I pray that you don't need one. But if you do, I hope you have become little wiser now. Thank you.